My name is Judith Masti. I'm a family nurse practitioner student from the United States University. I'm here to perform your head and neck exam today. Before I start the exam, I'd like to get your consent to the video. The video is going to be posted on YouTube for my instructor to view, and it's only for education purposes. It's not going to be for public. It will be on YouTube under unlisted. So could I get your consent to be able to continue with the video?
Continue, yes.
All right, thank you. Could you tell me your name and your date of birth?
Linda Tab, 3/29/50.
Okay, thank you. Before I start, touching anything, are you having concerns, any pain anywhere, maybe that bothers you before?
No.
Okay. I'm going to start looking just from your head down to your neck. I'm going to inspect to see, make sure everything is in a correct position. I can see that your head, the size and the contour, the hair distribution, everything is how it's supposed to be. I don't see any abnormal growth or anything, any protrusions. Your hair is nicely distributed. I can see that your ears are placed where they're supposed to be, and the top pinna is aligned with your outer canthus of your eyes. And as I come on your forehead, I look at your skin that is nice and evenly toned to your neck and what I can see for your arm. Then I come down to your eyebrows. Both of them, they're in equal positions. I see your eyelids, they have your eyelashes both on top and down. I see your eyes that you're blinking okay. There's no involuntary movements or anything, no twitchings anywhere. I see that your eyes, your sclera is white, your pupil is black, and slightly I can see that your conjunctiva is pink. Your nose is where it's supposed to be. You're breathing easily. There's no efforts in there to show that maybe you are struggling or in distress. And then I look at your mouth. I see that your chin, your mouth, everything is equal. There's no drooping anywhere, or a weakness of anything, or maybe any abnormal movements. Also, while I'm looking at your face, I see that there's no bulged eyes, called exophthalmos, and also ptosis, which is the drooping of your eyes. I don't see any of that. So I go, and now I'm going to palpate your I'm going to palpate your scalp. Make sure there's no dimpling in here or depressions, the pain or any cracks. The occipital bone is the way it's supposed to be. It's there, present. Nice kept behind your head. And then your skin is nice and warm. I'm going to palpate your temporal pulses and your temporal arteries. And then I'm going to come down here and feel your TMJ, temporomandibular joint. Can you open your mouth for me? And close. Again. Okay, I can see it here. I can feel it separating back and forth and going back in position. And then at this point, I'm going to palpate your sinuses. Your frontal sinus right above, maybe a little bit above your eyebrows. And here I'm pressing a little bit to see if you have any pain or pressure. At any point of this exam, if you feel anything in pain or any pressure, you can stop me or you can let me know. And then I'm going to come to your maxilla sinuses. Do you feel any pain or pressure? Okay. While I'm palpating, while I'm done here, I'm close to the eye, so I'm just gonna pull down your eyelid, down your lower eyelids to see, look in your eyes, and I see that your conjunctiva is pink, and your eye sclera is white, and your pupil is black. And at this time, I'm going to test your vision in so many different ways, and there will be shining of light involved. I'm going to grab my otoscope. I'm going to guide the otoscope with my finger so that it's not maybe like in danger for me in case I move certain way and I'm poking her in the eye. So I'm going to turn it on and shine in your eye and come like obliquely here to inspect your eyes, make sure there's no like jaundice or any redness in there. It's nice and white. Your conjunctival side is pink, and then there's no foreign objects. So I'm going to do the same thing from the right eye obliquely. I'm going to inspect again to see if there's any difference in color, and they're both equal. Their conjunctiva is white, the pupil is black. I'm sorry, the conjunctiva is pink and the sclera is white for both eyes. There's no yellowing or redness or that can be abnormal for anything. And both eyes, the pupil is black, and they are both equal. So there's no abnormalities that I can tell. So while I'm still looking at your eye, I'm going to test the light reflection of light on your eyes, and I'm going to turn it on again. Maybe back up off a little bit. I'm going to step back a little bit, and then as I shine in your eyes like this, I see that your both pupils are constricting, and also the light convergence is coming to meet towards the nose for both eyes. And then at this point, I'm going to come close again to test your eyes to see how they react to light. So I'm going again obliquely here to test your left eye. So when I test, I see the pupil is constricting, and then I'm going to come back again and test the pupil. The right side is constricting, and then I'm going to come this side again. When I shine, I see the pupil is constricting, and then I come back again and shine obliquely on your right ear. The left side is constricting. So explanation to this, it means that the eyes are both equal, round and reactive to light, and accommodating both to consensual and direct light. And this concludes this test here. So we're going to move to the peripheral visual field. I'm going to test your visual field. So I'm going to stand maybe here, but you're looking at me. So I'm going to put my hands like here and towards your posterior, and I'm going to ask you to tell me when you see my hands on both eyes.
I see.
Okay, then I'm going to go superior on the left side and do the same thing.
See them.
I'm going to go superior on the right eye and posterior on the left side, and you tell me when you see my hands.
See them.
Alright, so that concludes the test. Your peripheral vision is fine. Then we are going to test the 6 cardinals of Hayes, where I have to test your 3 cranial nerves, which is cranial nerve 3, 4, and 6. So cranial nerve 3 is the oculomotor, which kind of constricts your pupils and movement of the pupils, and also then the cranial nerve 4, which is the trochlea, is the one that makes your eyes move side to side, and your obducen, which is 6, that's where it closes your eyes. So I'm going to come here with my finger, and you look directly at me, and I'm going to come close to you and then go to your right eye. I'm going to go up, and I'm looking to see how well you can, your eyes are able to follow my finger. Up and down, go back to the middle, and I come back to the midline. Go to your right eye, up and down. And then go back to the middle, and then come back to the midline. So at this point, I'm going to come close to you, and as I come close to you, probably maybe about 5 to 15 centimeters, your pupils should be able to constrict again, and which they are. And that concludes that test. And then you're able to follow my finger, so your vision on that in that area, it's okay. And then we're going to do the what's called a fundoscopic eye exam. So I'm going to switch my otoscope here and put my fundoscope. And I have it on 0 right now, set on 0. I can move it side to side here to make the light more dim. And then we're going to dim the lights for this exam. I'm going to test your red reflex, right eye to right eye, left eye to right eye. And again, I'm guiding my fundoscope, make sure it's not into a position where I can lose control. So, is that right? Okay. So I'm going to test the right eye and see if I can see that. Okay, and I'm going to follow that. Oh, nice. So I'm going to come closer, put my hands around the forehead here, and I can see all the way. I can see the physiological part of her eye. I can see the disc and the disc cup and the blood vessels. And also, if I come somewhat close to the nose, I can see the macula and the fovea. Okay, alright, I'm going to do the same thing to the left eye. Okay, and try to follow your, see that? Again, I'm going to guide my scope, and I'm going to, I see the red reflex and I follow it, and I'm able to visualize your blood vessels, your disc and the disc cup, and the ratio on both eyes should be equal, around 0.5. And again, if I can see, come close to the nose a little bit, I can see your the macula and your fovea. So, and also, if you cannot see the red reflex, means there's something wrong with your eyes, a condition called cataracts, which you don't have. And then from here, before I go to the ears, I'm going to inspect your nose. I'm going to do the ear exam. I mean the nose. I'm going to do the nose exam. I'm sorry. So as I can see, she's breathing normal, and there's no efforts of any distress or anything. The nails are, I can tell that they are both open, but I'm going to shine light inside to make sure there's no. I'm going to make sure there's no anything growing in there. I'm going to just grab at the tip of the nose a little bit so I can see both nails, and there's no polyps or nothing growing in there. There's no cracks. The mucous membrane is nice and pink, and the septum is in the midline. The nose is where it's supposed to be, so it's good. Time I like that one, and then I'm going to, while I'm on this, I'm going to inspect your mouth because I'm already close to the nose. I'll do the ears later. Oh, yeah, I'll do the ears later. Like I already inspected, the lips are even. There's no deviations or any cracks or drooping or weakness on any side, on each side. So can you open your mouth for me? Inspect the gums. They look good. And the oral mucosa. Let me see. The oral mucosa looks nice and pink and moisty. And then I'm going to look at the back of your throat, like your tonsils. Okay, I see the tonsil area. They're nice and red. I don't see anything protruding or anything. Then I'm going to test your hard palate and the soft palate. Everything looks intact here. I don't see any deviations or anything. Then I think I'm done with the mouth. I didn't see anything abnormal. There's no oral hygiene concerns. There's no dental caries, and the gum, everything looks okay. There's no bleeding or any cracking in there. Tonsil areas nice and red. They're not big to where they're touching each other. I'll say maybe they're about maybe grade 3. Yeah. So, and then I'm going to go check your ears. The ears, I see the auricle and your helix. Everything is, I can tell that they are. There's nothing abnormal. They're in a proper position. Before I put any scope in the ear, I have to test something called tag test. And if I pull and you feel any pain either inside your ear or outside, then let me know. Do you feel any pain? Okay, so she's good on that. I'm going to do the I'm going to shine the light in your ears to inspect the inner ear, both external and the inner ear. And again, when I am inspecting in the ear, I'm guarding my scope, make sure it's not in the position where I can have harm. So I'm going to pull up and back to open the ear canal, and then I inspect both the external and the inner ear. And can see that there's a little bit of swelling in there, but there's nothing abnormal that's of concern. I see the in the back of the Marriott, I see that there's bone prominences, the umbo, and then let's see here, this one too. I don't see the mucous membrane nice pink, and looks nice and pale and gray inside there, a little bit white. And I'm going to do the same thing on here. I see a little bit white on the tympanic membrane. Wow, it's nice and cool though, just to look at that. Let me see. Again, to test the right ear, I'm going to do the same thing. I'll pull up and back, and I'm going to inspect the external canal and the inner canal, and I see that there's a little bit of swelling in there, and also the tympanic membrane is nice, gray and pale, a little bit white. And I see some redness, and also when I shine the reflection of light towards the anterior inferior, on the left side it was at 7 o'clock, and on the right side, when I shine towards the anterior inferior, it's at 5 o'clock. And then we're going to do the 3 hearing test. We're going to do the whisper test, and then I have to stand behind you there, and then you tell me when you can what you can hear. I'm going to say 2 syllable words, and you repeat after me, and then you tell me what I say. Could you occlude one side of your ear? The left side. And I'm going to baseball. And we can do the same thing on the right side. Apple. Okay. And then I didn't do the test of the nose. We'll come back to that. Let me finish my hearing. I didn't test the smell nose. So then the next thing we will do the test called the Weber, and I'm going to strike the tuning fork and put it on your forehead, and you tell me when you can hear this. You can hear the sound on both sides. You can hear them, okay? And then we'll do the same thing. And this one, I'm going to put it behind the mastoid bone of the ear, and I'll do the same thing on the right side. So after vibration, you tell me if you still hear the noise. Okay, and we'll do the same thing over here. Strike the fork and put it behind your mastoid bone. Okay, and what this tells is that even after the fork stop vibration, the noise is still going, which means it's traveling by air, and the air conduction is greater than the bone conduction. I'm gonna go back to the nose because I didn't do the nose testing. So I have 2 scents here, and I'm gonna ask Miss Tab to tell me what she smells.
raspberry.
And then I'm going to test on the other side of my hand. I'm going to put another percent.
It smells like cherry.
Okay, very good. So that concludes those tests. And then I'm going to move down to the neck. So the neck inspection again. I don't see anything glowing, any opening or anything. We already tested the flexion, but we can do it again. If one head, turn side by side and look down and maybe round. So the flexion is good. So I'm going to palpate the lymph nodes, starting from the front of the ears, called the pre-auricular nodes, and I'm going to palpate down here, coming down to the tonsillar area, using the 3 pads of my fingers, and I'm going to go down to the submandibular and then submental below the chin, and I can feel the nodes, and I don't feel anything that's need further investigation, anything that's hard, mass, or non-movable. And then I'm going to go behind her ears, post-auricular. I'm going to palpate them, and I feel them down, coming to the anterior cervical, and come down here. I can feel the knots, and then I'm gonna go to posterior cervical towards the back of the neck, and come down here, and then I'm going to go to the clavicles, supra clavicular nodes, and I can feel them. And then I'm going to go to the I'm going to come down below the clavicles, the supraclavicular ones, and I feel them here too. And also then I can feel the deep cervical, which are kind of hard to feel. Kind of hard to feel, but if you can kind of on the side of the first, and then turn on the other side first.
Yes, please.
And then turn on the other side. So you can kind of feel them, but
Henry, excuse us. This is very serious.
okay? Oh. So they have the deep cervical nodes, they're kind of hard to feel, but they're there. And then I'm going to test her thyroid. And I'm going to feel the trachea with my hand here, make sure it's in the midline, and then try to be ready on each side and it's nice and moving. So I'm going to sit in the back and do. Oh, don't, please. And then I can feel towards the thymus here. I can feel the thyroid gland, and okay, can you swallow for me, please?
Lollipop in my tummy.
And then I feel it's moving slightly in between my fingers.
Let me
swallow
taste
again.
it.
Alright, and then if there was a goiter, I can usually feel, like usually I can feel the goiter. Oh, please. If there's a goiter, I can usually see that she doesn't have any. So this concludes almost the head and neck exam. And we are going to do the visual acute, whereby she's going to stand 20 feet and to perform the visual acute. We can do. Can you check him because I have to stay in the video. Can you go away, please? Excuse us. Thank you. So it's the 20 feet. We have to test the visual accurate, and let me see if we can see that. I don't know if we can see that on the wall. Let me bring it down a little bit. Yeah, I can see it right there. Okay, very good. So without you can put your glasses on and then we'll test it without the glasses. So can you tell me what you can read here?
The third line up, EPTZ 0.
Okay, so that's the third line up, 1, 2, 3. That's 2020. Can you read this one?
No, I can't read that.
Okay, so you are at 2030 without. Did you read with glasses or no?
With glasses.
With glasses. Okay, now without glasses.
EPTZ 0.
Which one? This
The
one?
third one up.
This one?
No, third one up.
This one?
One more. Yeah, that one.
Okay. 2030. Both with glasses and nothing. So now we're gonna close your right eye. Can you tell me which one? Can you read this one?
No,
This one?
some letters I can see.
How about this one?
Okay, I can see EPTZ 0.
Okay. So you're kind of the same. Then close your left eye.
That one. EPTZ 0.
Wow, good. So with or without glasses, you are like 2030.
Oh, that's good.
Yes. So I don't know if I forgot anything, but that's probably that concludes our test. And I appreciate your time. Thank you so much.